everyone, and welcome back to the As You Are podcast. I always say this, but I'm really excited this time because I have a clinical psychologist with me. So excited to talk about mental health and her experiences as a professional. But most importantly, she's a really special friend of mine. So, really looking forward to this conversation.
Thank you. I've watched all the episodes and loved everyone. So it's a huge honor.
Thank you so much. So, Candice and I met at an organization called Tears Foundation. I'm sure a lot of people who live in Joburg or South Africa have seen them advertised. They are a non-profit organization that help people who have been raped and abused. So that is where we met, and to work with like-minded people who wanted to make a difference was so special. And then I ended up making such a good friend there. So can you tell us a bit about what is Tears Foundation, what we did there, things like that?
Yes, so like you said, it is an organization that helps women or men who have been abused in any kind of shape or form of abuse. And we also specifically, I think, were aimed at helping those who were sexually abused or assaulted. Mm-hmm. But we did occasionally have people who were suffering with mental illness as well. Mm-hmm. So I think on my kind of journey to trying to get into clinical psychology masters, it requires that you do quite a lot of volunteering. Mm-hmm. Well, I suppose it doesn't have to be volunteering, but you tend to go that route. So I was there as a lay counsellor. They called us intervention specialists.
Oh, yes. I forgot about that, yeah.
Yes, but essentially a lay counsellor. And we would answer the calls, kind of assist in that way, kind of give a little bit of containment on the phone, I think. But mainly our role was to point them in the next steps of what to do, and help them both in their times of distress or sometimes a little bit after, depending on when they reached out to us. We also kind of followed up with them quite a lot just to make sure that they were okay, they were on the right track, they had the information that they needed. And we did some part of our role, not so much, but also it was obviously a NGO, so we were a little bit involved in some fundraising and awareness campaigns and things like that.
Yeah, because this was a totally free service. So it's a call center, so even the number that you call was totally free, and we didn't get paid. Well, you did.
Yeah, I didn't initially, and then I stayed there for quite a while, and I became somewhat full term, and then I would get a stipend.
Yeah, so that is how we met. And it was so special, like I said, to meet people who had the same interests as I did, who wanted to help. And I was there for much less of a time than Candice was, and I found it challenging, especially because, I was only in third year of university. You had done your honours.
Yes.
I hadn't done my honours, so I was super, new to counselling and speaking to people who are really in the worst times in their life. And just like not knowing what the next caller is going to bring. And so, how did you find it?
Yeah, I was actually thinking about this the other day, and it's amazing that we kind of had these opportunities to kind of practice a little bit what we wanted to be going forward. And we got somewhat training, but we really had very little theoretical background.
Yeah.
And also, I think the organization did as much as they possibly could. But like you say, you really don't know what the person on the other end of the line is going to say, and you can't prepare for everything. So it was extremely anxiety-provoking in the beginning, especially. you're there to help the person, right? So you want to feel useful and tell them the right information, and so it was really tricky to kind of find my feet in it.
And learning to like think on your feet and know exactly, and you know, as much as they're panicking, then you become panicked, and so it's just learning to stay grounded and think what's best for them. And so then like I said, I only met Candice after her honours year. So before that, during school, were you always wanting to become a psychologist, or?
No. So originally I wanted to do medicine.
Okay.
I am from a school where it was quite academically competitive, and it felt like you could be a doctor, an engineer, or maybe a lawyer, something like that. Those were your options.
You didn't have many options.
No. Yeah. But also my mom was a nurse.
Okay.
And my sister is a doctor, so I think our household was interested in a lot of medical things, and we used to have lots of medical discussions. So I think straight like grade 11, grade 12, it's such a hard time to kind of decide for the rest of your life what you want to do. So I think I was leaning towards that because of my exposure, but also because it was somewhat familiar to me, if I'm being honest. So I really thought I wanted to be a doctor. I applied for that everywhere, didn't get in, which was okay. I kind of was expecting it. I decided to go to Stellenbosch University, and they had some kind of transfer program where at the end of your first year, depending on your results, you could switch, no matter what your degree was before. So I did a BA in humanities, and I did quite well. But yes, obviously didn't get into medicine again. Interestingly, I was close. I was really close. I got to be the second person on the list who was going to go. So there was a time where I was kind of like, someone's going to drop out and I'll get my spot.
Surely.
But I think in hindsight, I'm really grateful that didn't happen.
Interesting.
I don't think my personality kind of suits that. I don't think it was fully my passion, and so I wouldn't have poured into it as much as I could have. But in the meantime, I'd been doing psychology in my undergrad, doing the modules, which I really, really enjoyed. It was fascinating to me, and it was kind of really a pleasure to study compared to some of my other subjects. So that's where it kind of started, where the seed was planted.
Okay. So, was there any particular field in medicine that you were interested in, or?
I don't think I had even gotten that far.
Okay.
I was like, I'm going to be a doctor, maybe a GP, but you hear about people who are like, oh, I knew I was going to be a cardiac surgeon or whatever. That was never me.
Okay, and then you say that interest in psychology and mental health only sparked when you actually started studying psychology.
Yes.
And before then, did you have any interest in mental health, or?
I think a little bit. I think I was interested overall in the health kind of careers. I loved biology at school, and I really, it's a little bit confusing because I wouldn't classify myself as an extrovert, but I do really enjoy working with people, and I think I really wanted to do something purposeful in whatever career I chose. Purposeful to me, obviously, because I think every career has its place. And then I think kind of like actually I haven't come across a single person, and I think your podcast is testament to it. Every single human being has moments of distress and overwhelm, and times in their lives where things happen that they can't quite, or they feel like they can't really manage by themselves. And of course I also had those times, and I think the idea, kind of reflecting back, thinking, sure, I would have really loved to have someone be supportive that was objective, another mind that I could think in those times. I think that felt so valuable for me, and that really was like the driving force of my passion towards psychology.
But you put the nail on the head. You have to, we're going to discuss it, but to pursue any mental health profession in South Africa especially, you have to have that passion.
Yeah.
You have to, it's not something that you can just say, oh, let me try, get into masters. You know, it really is something that is so consuming.
Yes.
So you did your undergrad, and then did you get straight into honours?
Yes.
Okay.
I really wanted actually to stay in Stellenbosch.
Okay.
But I got into honours at Wits in Joburg. In I think it was either my first or second week, Stellenbosch called and said, we have a spot for you.
No, I didn't realise that.
Yes.
Oh, no.
And yeah, my parents were very supportive. We were like,
Shame.
we'll get you down there if you need
Shame.
to. But I think there were other things in my life that made sense for me to stay, and I was kind of settled a little bit. So I stayed, did my honours. I think you were more on the ball with your volunteering and stuff.
Yeah, I started from first year.
That's incredible.
But I knew from the day, like from high school, that this is what I wanted to do. It was, where you were still figuring it out. Yes.
And I will say at Stellenbosch, they didn't really talk about what it all entailed. And I suppose
really? So you were going in blind? You didn't know? Really?
I mean, people are like, oh, it's hard.
Okay.
But like I didn't have much information. To be
okay,
honest.
But you're also like, I've been trying to get into medicine. That's hard. Like,
I think so. I was like, I know degrees are hard. Like, it's gonna be okay. We'll figure it out.
Exactly.
But I guess I also wasn't asking all the questions, which probably definitely contributes to it. But they weren't really saying like, you need to start volunteering now. Like, this is kind of
what they don't actually. Universities don't. Yeah.
And even in my honours year, it was kind of like, who wants to be a clinical psychologist? And I know we all had to put up our hands. And then they're like, we only accept 10 people a year or something.
I know,
and you're like, okay, fantastic.
Thank you for that information.
Yeah. So I did my honours at Wits. And looking back now, it really was such a drop of psychology compared to what you feel like you need to know further down the line. And it's such a, I think I was coming to terms that it's going to be a difficult process going
in
forward.
honours. Okay.
And it's hard with the applications because part of it's academic and part of it is all the other stuff that you have to do. So I made a decision not to do any volunteering in my honours year. I focused on academics.
Probably a good idea.
Well, I don't know. I think it's all I had capacity for at the time. So I didn't do a drop of volunteering. I had done, like, our school was quite big into community service, and I'd obviously done a bit for medicine, but nothing crazy. So I applied for clinical masters that year in honours. Didn't get in, didn't get any kind of callback.
Yes.
Which honestly I wasn't that devastated. I kind of expected it. I had no experience, which is fine.
And can I just stop you there? Did you only apply to clinical?
I think in the very first time only clinical.
Okay.
The second time, I think I did apply for some of the others at a few universities as backup plans.
Okay.
But I didn't really want to go those routes.
Okay, you wanted clinical. That was sort of your focus.
Yes.
Okay.
Yes. I think it felt like it suited my personality more. And Yeah.
And also I remember you saying like you would then likely work in a hospital, which was sort of where you'd always imagined you were going to work. Yeah.
Yes.
Yeah.
Kind of catching on to those early, ideas of being a doctor, but something that was maybe a bit more tailored to what I wanted to do in this space.
Mm-hmm.
And then the second year, I finished my honours, and then I just jumped into volunteering. So I did SADAC, and I did Lifeline.
Mm-hmm.
We did Tears Together.
Tears Together, yes.
I worked at JPCCC for a while with the little ones.
Yeah.
We would do, I think it was like 10 to 15 sessions with 6 little kiddies per term. Of lay counselling, but play therapy. And then I also worked at Headway, which is an organisation for brain-injured patients and their families, doing supportive counselling there as well.
You did a lot.
Yes.
Yeah.
I think because you get into, the application process is so confusing and such a difficult, anxiety-provoking time, and I had my volunteering, which was what I had in control. So I thought, if I just do everything, my chances are going to be higher. This is what I can do. But also, after honours is a really tricky year.
So tricky.
Because you're like kind of far on the path of where you want to go, but not many people are going to give you jobs because you're not fully qualified.
100%.
So you're in this weird
100%.
limbo.
That, for me, if I have a message for anyone wanting to study psychology, I would warn you about that. With after honours, like you say, you're on that path, you're so close. Like, especially if it's something that you've been dreaming about, you're so close, you can taste it, but you also are not qualified in anything.
Yeah.
It's not like you do a 4-year education degree and you're then a teacher, or you do 4 years of accounting and you're an accountant. You do 4 years and you basically have nothing that you can do. That's why a lot of us are going to do a PGCE, which helps you then to be able to teach. That is something that you have to be so aware of.
Yes.
And also to sort of also keep in mind that most of the volunteering you don't get paid for.
Yep.
I don't think you could, except for Tears?
Except for Tears, all out of your pocket, and that's, money to get to these things.
Yep.
All your time, so I think we both did some au pairing on the side.
Yeah.
But that's not enough to get you through.
No.
So it's really tricky in that way, that time of limbo where you're not earning anything, and it feels like your life's a bit on pause.
Oh, 100%. 100%. Yeah. So how many years was your life like that for?
So I got in on my 4th child. So, yeah.
Wow.
So
it was 3 years, basically.
Yes.
3-4 years of you not earning a proper income.
Yes.
Of just doing something where you don't even know if it's actually going to help you.
Exactly.
Like, you don't know.
You're trying what you can, but it could be for nothing. Or it's also a reality. I think maybe what we haven't spoken about yet is from undergrad to honours. So you're in these huge undergrad classes.
Massive.
You bottlenecked into about 80 people per class.
I think about 18 honours, yeah.
And then you go to, I think it's between 12 to some universities only accept 5, I think. So it's so many people, not only just who you're studying with, but all the other applicants that haven't been accepted the years before, trying to get very limited spots. And so I think it's also, you have to be balanced in it, that you need to stay true to yourself and keep reminding yourself that this is possible. But the other part of you is saying, like, it's a reality that I might not get in.
And these 3 years can be a total waste.
Yeah. I actually don't know if it's true, but somebody also told me that your honors degree, after 5 years or something, they say, like, your knowledge is not up to date. So there's also, I think, so many people are anxious. So there's lots of kind of these rumors going around. You don't know what to believe, what's true or not, but it's a really, really tough time.
And also, psychology, going into studying psychology at university, for people who understand what it takes to get into it, who've been sort of prepared by outsiders, there's so much competition.
Yeah.
There is so much competition. Like, from first year, I knew the people who wanted to get into masters, and instead of being sort of collaborative and friendly with each other and seeing how we can help each other, from day one there was competition.
Yeah.
And it's a stressful environment to be in, and honors, it was just 10 times worse. Yeah. So when was your first interview?
I think I got through paper selections, I think, for Wits my second year.
Okay.
Didn't make it past then.
Okay.
And what's really hard, I'm sure everyone kind of does the same, but you apply to every university under the
100%,
sun.
100%.
So you're doing like 13 applications.
And they are long.
They are grueling.
They are long.
Ask a lot of personal questions and really like putting yourself rawly out there.
And long, like essays, like assignments.
Yes.
Yeah.
So yes, got through paper selection second year, didn't get any kind of invitations to go for in-person selection. My third year I got an interview at Wits. I think I've tried to block this out of my head a little bit. But I think I also got into Sifaku.
Okay. Sifaku Makato. Yeah.
I also got into Sifaku, but their selection process is at the exact same time as Wits.
No.
So some people try to do both and they race from one to the other. I said, no, I'm just going to do Wits.
Really?
Which is scary because, I mean, I didn't get in that year. So there's a lot of like self-doubt, like, oh, I should have gone and done
so
that.
Much.
But I got through to in-person selections in my third year. I got through to the final stage because Wits at that time, you did till like Monday to Thursday, and then on Thursday they told you kind of if you might be called back or not.
Okay.
It was pretty terrifying.
Yeah, tell us about the interview process.
Oh, I think it just feels like a really pressurized week. Because
so pressurized.
You have these years of volunteer work that you're doing. It feels like you get to the point where you're like doing your applications for months to try and make it the best that it could be, and like, saying all the right things. And it all comes down to this week.
That is so true. That is
so
much
pressure.
And just now you've got a flu that week.
Yes, or life happens.
Life happens. You can't make it.
Exactly.
Yeah.
So I think already everyone's very stressed.
So stressed.
It's quite competitive, I found.
So competitive.
You kind of all wait together before you go in. And some people's anxiety kind of spills over.
100%.
So it's hard waiting, and then you go in. So I actually have only done in person at Wits, so I don't know really about the other ones. But for Wits, you did a panel interview, So it was about 20 people, I think.
You're kidding.
You sit there in the
20
room.
people.
Everyone's kind of looking at you.
Oh my gosh.
It's really scary. I think before you get there, you do individual interviews with 2 people.
Okay.
And you do that twice. And then I think once you get through that, you go to the panel interview. You have to do a role play and also some kind of, I think they gave us a case study written. I think we got like 12 hours or something to do it. They asked some questions about the case study that you had to answer.
So this was all over those 4 days?
Yes. And then you wait to hear, which is really, really a horrible experience.
And then the people that you were being interviewed with, what were they doing? Were most of them doing community service like you were, full-time, or were some of them working?
Some of them were working.
Okay.
Yeah, I don't take it lightly that I think I was in a privileged position where my parents could help me in those years. But sometimes you don't have that option.
No.
You have to work.
Yeah.
So some of them were working and doing some volunteering on the side, on the weekends and things like that. Some of them were older individuals who had done like a lifetime of different careers and then had decided, which I think is incredibly brave. So quite a lot of older applicants.
Okay.
But a lot of honors students as well who had kind of just come out of their degrees. Yeah, everyone was kind of doing a bit of everything, I think.
Sure. So this time, when you were doing your interview, you got right to the end?
Yes.
And then how long did it take for you to get the outcome?
I think they say by that Friday. Sometimes they say we'll tell you next week. If there's that year, I think there was some deliberation. So I think we had to wait till the Monday.
And you didn't get in?
Did
you get an email?
Yes, an email. And it's you're just constantly refreshing your emails, waiting. Didn't get in. I think that you kind of tend to know what went wrong. For me, my group activity didn't go so well.
Okay.
So I had a slight feeling, but also you want to be hopeful.
Yes. But I also know from also personal experience, not getting in, because the interviews are so centered around you and your personality and your likes and your dislikes. When you get that rejection, it's like, what is it about me that they didn't like? What is it about me that isn't suited to this profession? Should I just quit now? Should I continue? Is it something I can work on? And what's also frustrating, I don't know about Clinsac, but they didn't really give me good feedback.
Any feedback.
It was like a generic, there was so many applicants.
Yes.
And so then did you ever feel like, should I carry on or?
Yes.
Yeah.
Especially that third time.
Okay.
And you're right, there is so much self-doubt when you're sitting in a room with 20 professionals and they are saying no, and these are people in the profession that you trust and you like. It's impossible to not feel like, okay, well, maybe I am not suited. Maybe this isn't what I should be doing.
Exactly.
There's something about me personally that isn't well suited.
Exactly. So then on you did try again?
I did.
Okay, good for you.
I think for a month or so I was like, I think maybe I need to think about doing something else because what am I going to do?
Yeah.
I said to myself my 4th time was going to be my last try.
Did you?
I don't know if I believe myself. If I didn't get in, I might have tried again.
Yeah.
But I think when also maybe something important that I would have loved to know is when you're in that process of applications, normalizing those self-doubt feelings, because I think it can feel so lonely because it is a personal experience, but it's also something that is just a part of the process. And giving yourself time after those application processes to kind of grieve what you thought might be. kind of resettle a little bit.
Yeah.
There is time for
Yeah,
that, and I think
definitely, so true. So then you got into interviews again, fortunately the fourth time.
Yes.
Were you more confident this year, or?
I'm sure anyone who's trying to get into psychology, the like generic thing that people say to you when you're like, what do I need to do? They say be yourself.
Oh, always.
And it's so irritating to hear when you're in the midst of it.
Yes.
But I think in that final year that I tried, something had shifted in my mind, and I'd really said to myself, I'm going to give it my all. But I strangely was not as nervous that time.
Interesting.
I did feel like I was more myself.
Wow.
I didn't know what they wanted, so I thought instead of trying to say what I think they want, I'm just going to be fully authentic.
Wow.
And I think in even one of the interviews I said to them, which in hindsight is a bit of a risk, but I said, I'm very passionate about this. I think I can do this well, but also if I don't get in this year, it's okay. It's not my whole life.
Oh, wow. Okay.
And I really believed that. I think I had gotten to the point where I had made it my whole life for those first 2 years. But I couldn't keep going like that. It felt so scary and so unknown.
Yeah.
And I just had to try my best. And whatever happened would happen. And I would pick up the pieces and figure it out from
100%.
there.
So then you got in. Best moment ever.
So surreal.
So surreal. Like, all of this fighting, it finally paid off.
Yeah.
So you finally got in, and then you started the next year. And, everyone says, oh, Masters is so tough. Masters is so tough. And I was like, Candice, she's smart. She'll be fine. And I remember she was struggling. So what makes it so tough?
I think, like I kind of said earlier, what you're exposed to in undergrad and honours is really the very tip of the iceberg.
Yeah.
And I mean, it makes sense why it has to be that way. But firstly, like just the vast amount of knowledge that's thrown at you, which is amazing, but also overwhelming, is really intense. The pace is intense. Lots of assignments, lots of seminars, which were like presentations that we had to give for different modules, like a 3-hour presentation to the class. Research is a huge part of it. That you don't actually really get set time for research in masters. You do it in the background of everything.
Yeah.
And I think it is, in a weird way, quite a personal year, where you're confronted with quite a lot about yourself, about who you are, about what kind of therapist you're going to be. That's a bit unexpected. And it's also obviously the first time that you are doing practical work, which is scary.
Yeah, no, I remember you saying like you were at Wits from 8 to 5 or 6 at night, like.
Yeah, some of the days were super jam-packed.
Yeah.
It did get a bit better as we went on in the year. But yeah, we also did assessments, psychological assessments, and you're kind of learning a test in a week, and then we would have to submit like a write-up on the test that we learned. Whereas I feel like a single test you could probably spend a month on really understanding and knowing the cognitive theory behind it and interpreting it accurately. So it feels like a lot.
A lot. And then they always also say that you become very close to the people that you study with. So were a lot of the people you studied with, did they have similar stories to you? Like in terms of, did they also try many years to get in, or was it different?
I think it was very varied.
Yeah.
Which I think speaks to how the application process really doesn't have a rhyme or reason.
Yeah.
it is quite subjective. I think it counts depending on, well, I personally believe some of it is luck on how you present yourself that day, if your nerves get the better of you or not. But they also look at the cohort, so it's a bit of luck if you fit with that cohort for the year or not. And I also think a large part of it is obviously being in your own therapy, and I believe what they're looking for is some kind of self-awareness, self-development.
Definitely.
Not to have it all figured out or perfect, but to have been in a kind of process like that is important. So yeah, it was varied. We had some people in our class that the first time that they tried, they got in.
Wow.
We had some people that were 3 years, 4 years, 5 years. We had a mom in our class, or actually 2 moms in our class that had done different degrees in their lives and had decided to change.
Very varied. Yeah. And so then you finally finished that year.
Yes.
It was super grueling and tough, but you finished, and then you went on to your internship. So can you tell us a bit about that?
Yes. So for your internship, you get placed at 2 different hospital sites for 6 months and 6 months. So my first rotation was my adult rotation. And sure, if I thought the learning curve was steep in my M1 internship, it's just a really steep incline.
Really? You're still learning a lot.
Yes.
Wow.
I think even more so, masters kind of gave you that theoretical background that you needed with a little bit of practicality, whereas internship is full practicality.
Okay.
But it's a really tough year because you have to do so many different parts of the day to meet HPCSA requirements.
Yes.
Which is hard because you, like, some days you don't have a minute to eat lunch kind of thing. Other days are a bit better.
Yeah.
But it was such a nice experience at the same time because it's really the first time that you can kind of picture what your life will actually be like in this career.
So you were in like a hospital setting.
Yes.
So that was your adult
rotation for 6 months.
6 months, and then
I went to my child rotation.
Okay.
So I was in the adolescent and eating disorder wards. At the hospital that I was at, it was like a kind of combined ward, even though the patients were in separate kind of rooms, which was very, very interesting. I think some people got placed in little children's wards, so you kind of get luck of the draw.
Yes. So all of you have to do 6 months adult, 6 months children.
Yes.
Okay, I see.
Or some people start with child.
Okay.
Then,
I see.
Switch it.
Okay.
But super fascinating, and I think the best part of it is that you are learning and doing, but you're doing it with a lot of support. You have
nice.
so much supervision.
Nice. Yeah.
You have so much contact with, therapists that have been there for years, imparting their knowledge on you in real time. So that was really, really fascinating and so special to have, actually.
And I think this is maybe a difficult question because you did so much community service, and you did your practical, a little bit of practical during M1. But do you ever remember like your first session with someone where you were, and like what was that like? Like, do you remember that?
Like where I was a little bit taken aback.
I'm really doing this.
I think for me, I thought maybe in M1 we would be eased into pathology.
Yes.
Which wasn't the case.
Yes.
But I think it's also important to know because it's a reality. Like, we were seeing a lot of students and younger people. That's kind of the population that we were seeing in M1. But a lot of people are struggling with so much behind closed doors that you would never expect. And really, really struggling with pathology, not everyday stresses or anything like that. So I think from the beginning, there was lots of those moments where I was like, but obviously, I think for many beginner therapists, it's that first time you have a suicidal patient. That can feel really anxiety-provoking, and I think as a new therapist, you feel incredibly responsible, and it kind of hits you the gravity of kind of holding somebody else, another human being in a space with you.
Yeah, sure. That must be very tough. And also, how do you then not take that home? Like, does it play in your mind afterwards? Like, I'm sure it's something you have to learn as well. Yeah,
and I think something I'm still learning. Different patients affect you in different ways, and essentially, as a therapist, you are a tool for that patient, and you are there for them to use you in different ways. But you're also another human being. So, of course, some of the things will affect you. Some of them might be quite similar to your experiences. So, yeah, I think it's gotten a bit easier. In the beginning, I found myself thinking quite a lot about patients and kind of struggling to separate that. As I've gotten a bit further, I think I do some practical things. I really try not to bring too much work home so that I have actual physically separate spaces. If I do bring work home, I have a designated spot, a little desk, and I really try not to do it anywhere else in the house, because I think psychologically it kind of helps to have that separation. Obviously, going to my own therapy is so important so that I can debrief with someone. I can think about how a patient affected me and why particularly it affected me. What about me that it's kind of catching on? Obviously, supervision is so important, because sometimes you can't always see when, you're in an enactment or... I'm early on in my career, and I think it's so important to have more experienced mind just thinking about your patient with you, because that's ultimately what they deserve, right? Someone who really, really is so thoughtful of the complications that is a human being. But other things that I think helped me, and what I found really important for me, is being really intentional about how I am spending my downtime and listening to my body. Sometimes I do just need that time by myself. Sometimes I need that distraction of getting into a book and kind of, letting things go. Sometimes for me, it's spending a lot of time with my friends and family, so that I have, good things in my life, because you're hearing a lot of sad trauma, people's distress in their rawest form.
Yeah, they don't come to you because they're happy.
Exactly. Exactly. So you really, I think, taking care of yourself is so important, so that you can be a good therapist.
Yeah. No, that is so true. So also, could you give us a little bit of what is your scope of practice as a clinical psychologist?
Yeah. So the clinical psychologist differs a little bit from the other streams in that you are more involved in more clinical settings, number one, like the hospitals, but you can diagnose, treat, and work with more severe pathology. So things like psychosis, the more that side of the spectrum where people are struggling quite a bit. And then, of course, because you're in those clinical settings, I think you do kind of work in the MDT, the treating teams with, psychiatrists, social workers, occupational therapists, a bit more, just because probably a bit for convenience, not to say that the other psychologists don't do that. But I think you also do a lot more inpatient treatment because of the setting.
So people who have been admitted into hospitals.
Exactly.
Yeah.
Yes. And I think it's the kinds of patients that you're able to see that differs a little bit between the different streams. Like obviously an educational psychologist is more based in schools, and they tend to see children or adolescents more. So
Yeah. And then also I think a big part is diagnosing.
Yes.
So you are able to diagnose and testing and things like that.
Yes. So for me, in my mind, a clinical psychologist and an educational psychologist are the most similar. But yes, so those are the two that can kind of do psychological assessments. The educational psychologists sometimes do a little bit different, more school-based ones. But as a clinical psychologist, you can run a test battery on patients. You kind of are taught and have the training to know what kind of test to use and write reports that can be used for school placements. It can be used for disability grants and things like that. And then obviously the point of all of that is for the diagnosis that can open doors for treatment for them essentially. But also working quite a bit with diagnoses with your patients, with your therapy patients. And I kind of want to say that maybe with a pinch of salt, because diagnoses are helpful and sometimes it can be so helpful for the patient, but I think it can also be a misconception that I think clinical psychology can be thought of in quite a medical way, where you give the diagnosis and that's kind of it. A lot of times with patients, talking specifically about a diagnosis can be quite like boxed in and not always so helpful. So of course with every patient, it's treating, working with them in a way that will best suit their needs and what would be most helpful for them.
And I think you also do a lot of work with the families as well, or not really anymore?
Not really. We can do family therapy and couples therapy and things like that. If you are seeing child patients, of course you do. You have feedback sessions with the parents or the families. But if you're seeing an adult patient, we keep it confidential.
Okay.
We really try to separate that quite a lot.
Okay. Also something I think a lot of us lay people, when we think of psychiatric hospitals or psychiatric treatments in those facilities, we think of it as, you see movies and you almost think of it as like this dark, scary place to be. What is it like working in those settings?
Yeah, so like you say, I think there are quite a few stereotypes about it. I think it does differ from hospital to hospital. Where I am, from my experience, I can tell you about what it's like. So we have a male and female psychiatric ward in the hospital, so we have psychologists in our team. We kind of assign different roles throughout the year, but you work with the MDT, so the consultant, the psychiatrist, different MOs, social work, occupational therapy, things like that. But our direct work with the inpatient patients. But our direct work with the inpatients is we will see them for group therapy in the ward. If a patient requires individual therapy, we also do that, but we don't do that with every patient, specifically in the psychiatric wards. There are government facilities, so, it can be quite under-resourced. And you are exposed to not just psychiatric care. There's a lot of hospital trauma that kind of happens in those kind of settings, which can be jarring at first. We also do something called consults, where we can go to anywhere in the hospital, wherever a patient might need some kind of psychological help. And then we see our patients as well as our department, which is quite similar, I think, to non-clinical settings.
Okay. Yeah. And then, we've been talking a lot about how it's this emotionally taxing career, but what is the good sides to the career? I'm sure there are. Yeah.
There are so many good sides, and I'm so glad that you said that, because, I think people do focus kind of on the negative a little bit. But I think the good things are, it is such a privilege to sit with somebody else, and to be able to create a space for them where they feel safe enough to start talking about the most difficult parts of themselves. It's obviously a very patient-focused process, and that's so important in therapy. But you also, as an individual, I think, learn so much from different patients, not just in the theory or kind of their pathology or things like that, but there's something quite incredible about being able to experience human beings in such sometimes quite intimate settings, right? And I think for me, I spoke earlier about really wanting to pursue a purposeful career. But I think it's, such a job that really, as much as it takes from you, it gives back a lot. It really kind of gives you a deep sense of fulfillment. And it makes you feel like you're doing a difference, and not in a big way. And, it's about the patient, and it's unique about that patient, and it's not about my hopes or wishes about that patient. It's about helping them understand themselves. But it's really, really incredible to see patient strengths, to see how patients can cope with different things and learn about themselves and take those tools going forward.
Oh, thank you. Thank you so much for this conversation. I was so excited, and you didn't disappoint. It's such interesting stories and such an interesting journey. And asking you this question, I'm so excited because I just think you have so much knowledge. So what do you wish more people knew or understood about mental health?
I think that's such an important question. I think what I think about often is mental health can often feel like it's only something that you need to pay attention to, or need to go to therapy for, or need psychiatric assistance with when you are in the midst of a crisis, or if something traumatic happened, or when you are struggling to cope. It will always give your life so much value to know about yourself, and to not feel like you have to have had something huge happening before you take notice and care of your mental health.
Yes. Thank you so much. I hope to have you again.
Thank you so much for having me.